Hi beautiful people, welcome to another video. In this video I'm going to be showing you some of the study materials that I bought to hopefully review over the summer. Basically my plan is that once I graduate in May, I'm basically not going to be a student until next year. I'm hoping that I get into nursing school by that time. So I'm going to have about 6 to 7 months of the year before nursing school if I get into the spring cohort, or even longer if I get into the autumn cohort for 2027. And I've seen a lot of content creators talk about being ill-prepared for nursing school, or wishing that they had studied for certain things before entering nursing school or reviewing certain things. And I know because of my non-traditional path that some courses that I took 3-4 years ago aren't fresh in my mind. So I'm going to be sharing some of the materials that I bought recently, and if you have any recommendations, definitely link them below. Please know that none of these in any are like sponsored, or I didn't choose them for any really particular reason. All of these were from Amazon. If you really do want a link, I can definitely provide one, but I just searched the various topics on Amazon. These are what came up, and I just chose the one that looked the best to me. These, I did see an ad for one of them after I bought it, so I don't know if that's relevant at all. The first one is definitely one I've seen on Instagram quite a bit, and it's from Nurse in the Making, which is the NCLEX pharm card. So I know pharmacology is one of those subjects that is supposed to be really difficult and really hard. So I wanted to definitely get started on that, get started on learning and reviewing. Before I get into these, basically the format of this video is going to be me showing you the materials. There's only a handful here, and then also sharing kind of maybe a flip through of some of the materials in case you might be interested in getting these if you are a nursing student or pre-nursing, pre-medicine, whatever, and you're just interested in the topics. Then this might be a great way for you to see what is in the material themselves. And then also kind of talking about how I plan on studying, how I plan on using these materials, what other materials I plan on using, and I'll get more into that later on. As I showed you just now, Nurse in the Making, I know, is a very popular nursing brand. I see them on Instagram all the time. I know that I have some notes on my iPad that I purchased. I don't know if it was the same company, but they were also nursing related notes. I would probably go back and buy the physical version of that, just because for something that's so content heavy, I think I would prefer to have a physical spiral bound book. But for these, we have the pharm flashcards. I'm not really a flashcard girly. I've never really been one. I think I've used it maybe in like a handful of classes, but then again, I feel like when I was in high school and early college, I was much more interested in like Studygram and like Tumblr and like studying on YouTube and all the really early 2000s girlies that were all about organization and note-taking and all those things, and I really loved that vibe. So I played around with a lot of different studying styles based on what I saw, and I think there were some cases where physical flashcards worked for me, but overall I think I was just put off by the amount of work it felt like it needed. And as I got older and went into college and had all these courses, it felt like an unnecessary time hog. So having pre-made flashcards would definitely be interesting. They are pretty thick. So there's the flashcards themselves, and then there are like dividers, and then like separations for like study me more or I'm a pro, which I like this because one of the study materials I plan on using is Anki. I really enjoy Anki. I always have when I do actually make flashcards. So I think having this in like a physical format would be really cool. Okay, so they are very large. I can barely fit them in my hands. So we have this, and then this is how many there are. I already bent the first one. So we have, this one is tamsulosin Flomax, and it's definitely related to the urinary system. And it shows the drug, and then it shows, I guess, what's on the card. And on the back, it has the drug name and class, mechanism of action, therapeutic uses, must-know side effects, and patient education. So this is definitely really cool. I'm not going to go through every single one of them, but we have like antihypertensive medication, factor XA inhibitors. So that is really cool and really fun looking. I love that it's so colorful, because I feel like I might be a little more motivated to actually use them. I feel like I'm getting into color a little bit more, as you can see. This is the most colorful item I own. So we have the pharm flashcards. Next one, I already started kind of reading through this one, but we have Medical Terminology by the Wiley Company for Dummies. I really love this company, mainly because I just like how simple they present materials, and it's just really easy to follow. You can skip around, as they have the disclaimer of they're not medical professionals, they're not like experts in their field. So this is not going to be like your standard textbook, for example. For some reason, I thought I'd already learned medical terminology, and then I looked back over my transcript and realized I hadn't. I had taken Spanish for healthcare, which is definitely something I would love to review by like reviewing my Spanish information. So there was definitely some terms there, and then I also became a certified medical scribe. I haven't used that certification, but that course that I took was also teaching medical terminology, but this one is definitely much more in depth. It breaks it down by like body systems, and it also has like an overview just in the table format like this. So this would be a situation where I would probably create flashcards, because otherwise I'm just going to be reading this. And again, I'm going to get into the study materials I plan on using, but a large part of how I plan on learning and retaining the information is going to be through active and passive learning, through flashcards and through creating audios. So I'm very excited for this. And I also learned medical terminology in anatomy and physiology, so it's not all going to be like brand new. I am a science student, so I've probably seen a lot of these words before. This next one is the one that was advertised, and it just looks so fun. So we have the top 200 drugs simplified. This goes into pharmacology as well, pharmacology for the visual learner. And what was funny about this is I couldn't see anything about it on Amazon. I couldn't like view the inside of it, but the ad that I saw showed it, and it's even better than I hoped. So it's basically like a coloring book, which it's so fun. So it has mnemonics, it has like things you can color, it has just these fun cartoonish visuals, which I feel like is going to make it so much easier for me to remember and learn things. Because I am a visual learner, I'm also an auditory learner, I'm a kinesthetic learner. I can learn in many different ways depending on the topic, and like just engaging all of my engaging my kinesthetic with like being able to color, and also my visual with all the cute like animations and cute cartoons and images and like the mnemonics, and just making it easy to remember like this is going to be absolutely beautiful. Now, of course, my goal in all of this is to learn, right? And it's to learn, but also not necessarily memorize, but to understand, so that when I'm presented with the material a year later, it's not foreign to me. It's not like, oh my god, what is this? You know, so all of this is meant to help me have like an introduction to the topics. And as I'm looking at this, I'm realizing a lot of what I got was pharmacology related. The next one I got is this 2026 edition, the Safe and Confident Nursing Pharmacology Workbook, From Study to Confident Bedside Action. It's just this, again, one of the first results I saw on Amazon. Unfortunately, it was bent in the package, which was such a bummer. So yeah, it is a workbook, so it has, you know, questions, quizzes. It also gives you an overview. So here, chapter 1, cardiovascular pharmacology. It gives you basically a summary of, we have the overview for cardiovascular pharmacology and drug targets, the heart as a pump, where pharmacology begins, major drug targets in the cardiovascular system. So it's not just the workbook, it does actually provide you with some learning material in the beginning. It is definitely very dense, but I like workbooks especially because, you know, if you're learning material for the first time, quizzing is definitely a very productive way to learn. I don't remember what class it was for, but I remember my form of studying for, like, I think my freshman semester was to form quiz questions instead of doing flashcards, or I took notes and then I would write in the margins of the notes, because I did Cornell style. I'd write in the margins of the notes questions that I had relating to the topic or questions that I thought of, and it was surprising how many times those questions actually ended up being pretty similar to the quiz questions. So I'm just gonna say right now, I don't plan on being that person that uses AI to create their questions or their study materials. I think that AI is a great tool, but I feel like overusage can also be very irresponsible, both for the environment but also for our minds. You know, I really want to get back to a place where I can stimulate my brain to learn and to remember information, remember facts, and to be comfortable with that and rebuild those connections in my brain. And I feel like when we start to rely too much on our computers or AI, it can be a lot harder for us to easily form those connections. And for something like nursing that is directly related to patient care and, you know, life-saving measures, I don't want to be so reliant on having to pull out my phone every time. So I really want to stimulate myself to be able to create questions on demand, to be able to just study easier. And right now I'm at a point where I'm kind of watching YouTube and watching videos and stuff, I'm challenging myself as well to listen to more auditory things or to try to watch more educational content as well, rather than just entertaining videos. I just saw a video about a woman who was showing us how to create or form research for a PhD. And although I don't plan on getting a PhD, I do plan on getting a doctorate in practice, and it is relating to research, and I want to start stimulating myself to do my own research. So that was a very valuable video. I went off on a tangent there, but I just have 2 more materials. Medical dosages calculations for dummies. Once again, this is relating to just kind of math and how to, of course, do medical dosing properly. I actually didn't think this would be a super huge topic, but again, one of the content creators I follow, I wish I could remember her name, her username. I think it's Shiba or Shika or something like that. Her video was like things I would want nursing students to study before going to nursing school, and it was anatomy and physiology, pharmacology, dosage calculations, and I think there was something else. But immediately after I saw that, I was like, let me start looking into these. So I'm very excited for this. We have converting to identical units, which is pretty, like, I expect that this would be basic math, essentially, like things I'm confident in, but I have seen certain questions where there are multiple factors involved, and I will say I think I'll be okay in terms of the math itself. I'm just seeing mostly a lot of math, concentration, conversions is a big part of it. And again, because conversions aren't necessarily something I've had to memorize, that's definitely something I'm very interested in looking at and being focused on. And then we have the last one, anatomy and physiology workbook. So this one, of course, is anatomy and physiology. I haven't looked too much at it yet. It looks like there's some cellular information here, which I just took cell biology, and then before that developmental biology, so interesting, a lot of quizzes. We have some like directionality, chemistry. This is where it's like cellular, nuclear stuff, cells, nervous tissue. So I'm really hoping this goes into depth in the way that I hope it does, because, you know, I know obviously you need to know the tissues, the muscles, the organs, and organ systems and their functions. So yeah, this is precisely what I wanted, basically being able to label specific vertebrae and things like that, being able to directly label things. And this one and medical terminology go hand in hand, because medical terminology, the way that it's structured with the root words, prefixes, suffixes, it's all meant to show directionality or what is happening in that procedure or in the body where something's located. So I'm very excited for all of these. In addition to these, I also plan to review my nutrition notes. So I have all my PowerPoints and stuff from this past semester, this past session for nutrition. I also have some textbooks from when I attended another university and some other books I got while I lived in Sedona. This one right here, these 2 right here, Health and Fitness for Life, which is basically kind of like a sports sciences type subject matter, where it's telling you, it goes into detail about how to exercise and how to be healthy, essentially. So I really enjoyed this. And then the other one was Wardlaw's Contemporary Nutrition, 12th edition. I would love to be able to buy my nutrition textbook from this semester. I actually know the name of it and I had it saved on Amazon, so in case I decide that I want to save that, I know how to get it. But I think I would just probably stick with the one I have, just because I'm pretty sure it's the same topics. So those are all the materials, plus the pharmacology flashcards. And again, I already kind of went into it in terms of my plan about using Anki. So let's go a little bit more into detail about that. I work full-time, obviously. So I work 40 hours in a job that is pretty much like walking consistently. I'm an EMS. I'm a EVS worker, so I'm currently a hospital custodian. I plan after I graduate in May, shortly right after, I'll be taking my CNA certification class and then exam, and then once I pass, I'll be moving on to a CNA position. So that's going to be very different in terms of, you know, currently I'm kind of able to have my earphones in. I'm not supposed to, but I have these little small ones that I put in, and I may not always be listening to something. My light just went off. I may not always be listening to something, but I will, you know, it's just there. Okay, well, I guess it's dead. So I'll usually be listening to something, basically, even though we're not supposed to, but sometimes I'll be listening to like a podcast or something. So using that aspect, I plan to, where I can, either find auditory reviews of the topics that I'm reading or covering, or creating my own through like just a regular voice recording and playing that back for myself. Now, as I said before, I'm a multifaceted learner. I learn in many different ways. As much as I can be an auditory learner, it doesn't mean that every auditory situation is going to be beneficial for me, especially if there's a lot of information. So I've also found that as much as I love listening to things quick, like I like listening to fast speakers, sometimes I also like listening to things very slowly if it's something that's like I don't fully understand. So I need to have something where I can regulate the speed at different times, and speaking out loud while I'm learning the topic is going to be very necessary as well, or in my mind, speaking aloud in my mind. Having focused study sessions is going to be very significant. To tell you the truth, I'm very excited about the prospect of reading all of these materials and learning freely on my own time, but it is going to definitely take a lot of discipline, right? Because I spoke about in my educational, like non-traditional education video, how intrinsic motivation has as much of a impact for me as extrinsic motivation. So being able to like motivate myself to go forward and or do it even when I don't feel motivated is very important. With a school system structure, you're motivated by deadlines, you're motivated by grades, right? So I need to maintain that level while making it stress-free enough that I'm not I don't feel repelled by it. So it's definitely going to be a balance. I've been watching some videos about people creating their personal curriculum. I don't think that I'm going to necessarily consume all of these, like reading it like a book. I'm very tempted to. I might, but I might not. I definitely want to approach it in a way that's systematic. And again, like I said, I'm making sure I'm learning. And I also want to make sure that I'm taking in the information. So, a lot of these are broken up by chapters, especially the anatomy or the for dummies textbooks. So I was considering whether do I want to kind of approach each of these subjects or books as like a class, and then have I'm going to read chapters 1 to 2 of this book today or this week, while also focusing on this simultaneously. Do I want to study everything simultaneously? It's easy to say I have 7 months, I can just do a book a month, or I can just focus on it one at a time. But then as I move forward, I also need to make sure that I'm repeating the information from prior things, which is where Anki would come into play. And again, having the discipline to do that. So it's a lot of different things that I'm trying to consider right now in creating a curriculum for myself. As you saw, most of this is pharmacology based, so that in and of itself is going to be its own thing. And there may be other topics that I find that I'm going to have to review before entering nursing school. So these are the ones that I'm most concerned about right now, but there may be other ones that I learn of or realize hey, I should probably review this and have this information. And I just really want to stress for myself moving forward, just having that desire to learn again and being excited to learn again. Again, with school, with advanced classes, it can be very easy to get burnt out. And, with nursing or with any medical profession, you're consistently learning, right? So the last thing I want is to get to a point where I dislike learning or I feel that it's challenging. And I don't want it to be challenging. I want it to be, if it's challenging, I want to be willing to take on that challenge and be compelled to continue with it rather than to be okay, I don't want to do this, right? And especially post-graduation, I'm just gonna relax now, it's finally summer, that's kind of the energy I'm in right now. I'm on spring break, I have a few more days of spring break, I had a vacation last week, and I'm just I never want to do school again. But no, I need to be able to maintain consistency and discipline and make it enjoyable for myself. So once again, if you have any topics that you think that a nursing student, if you're in nursing school, that should be reviewed, especially for an advanced nursing program, definitely let me know. And I will definitely keep you guys updated on my curriculum, so to speak, of how I'm planning on studying, when I do actually start creating study materials, what I'm going to be doing, or how what it looks like, etc. But yeah, that's pretty much it. Yeah, I'm excited and a little intimidated, especially by pharmacology, because it looks very intense. Just like I said, I really want to kind of join those neural synapses again and create new connections in my brain. I feel like just over time, my attention has just become less, especially because I did take a gap, like that 2 to 3 year gap of school. So coming back has been kind of like, I feel like I'm in a new generation of students and a new generation of school. And it's not just about being in person versus being online. It's just a very different approach to school than even as soon as 3 years ago. There's a lot more AI now being stressed. There's a lot more, the way that things are done are different. And again, it could just be a difference in schools and curriculums, but the way that research is conducted or what's expected of me is very different. And I want to make sure that going forward, I have that critical, sharp thinking that I was always kind of aware that I had, I guess, or always thought to have had. It's weird going from being kind of the smart kid in high school, in like a small high school class, and then suddenly being in like a large public college and you're getting C's. I was reviewing my transcript from Rutgers and I was like, wow, I got a lot more C's than I expected. Like on average I had like B's and A's, but I'd have like 1 C per semester, and I was like, wow, I did a lot worse than I remember. But like the physical sciences weren't as easy for me as I expected. So those might be things I have to review as well. I also have a biochemistry book up here that I got because I thought I was going to be taking biochemistry. I may actually review that again because that was one of the classes I didn't do too well in. But yeah, I'm a little nervous. I may start reading some of these more passively just to kind of like take in the information, have that first pass of it, but eventually it's going to have to be being able to apply it in certain ways. One of the benefits of my EVS position, as I think I've mentioned before, so one of the things that we kind of get to see is the board, which doesn't tell you a whole lot, but the patient board, when you enter a room, that the nurses and CNAs are supposed to fill out. They don't always, but sometimes you'll see the medications and the dosages and maybe explanations or questions that the patients had, if it was kept up really well. And so a lot of the most common drug I see on like the med search unit is Dilaudid. As of right now, no freaking clue what Dilaudid does. I'm assuming it's like a pain reliever of some kind. Couldn't tell you. But like now that I have these pharmacology materials, I'm very interested to see how, as I learn about new things, when I see them in the wild, so to speak, how will I be able to attest to what it does and kind of have that mental recall of like, okay, that's what that is, that's what that does. So my whole goal over the summer, over this year, is really going to be to renew my love of learning. And it might be weird to say that while I'm still in school, but right now, to be quite honest, the whole goal with the next month and a half is just to get the grade and to graduate. That is how the pace has been with having accelerated classes, is that everything is just so fast. And yes, I'm taking in the material, but unfortunately after that exam or that quiz or that essay is done, it's not something I feel the need to actively recall. However, of course, I am still learning, right? So if someone were to bring it up in conversation, then I should be able to say, hey, I actually learned about that. This is what I know. That's something, one of the main reasons I want to review nutrition is that I've now taken it twice, and I have a general idea of the benefits of certain nutrients. I have a general idea of just overall healthy eating and composing a healthy plate. But to say, for example, what is the effects and symptoms of toxicity of taking too much zinc, or toxicity of taking too much potassium, for example. I remember noting in one of the discussions towards the end, our last few chapters were about vitamins and minerals, and breakdown of like individual things. It's like, for one, we didn't have any necessity to have to actively recall specific things, because again, the quizzes, the exams were open book, so we could review the information on site without having to actively memorize it. And one pattern I noticed was that many of the malnutrition or undernutrition symptoms versus overnutrition symptoms, or taking in too much of a nutrient, the toxicity, many of those symptoms overlapped for different within the vitamin or mineral, and then amongst other vitamins and minerals. So you saw like organ failure, or you saw maybe blemishes on the skin, puffiness, or discoloration of the eyes, or hives in the mouth, or something like that. But you could see it in any number of cases. So I really want to challenge myself over the summer to start kind of thinking like a nurse. Thinking in terms of, you know, what problem solving, critical thinking, you know, when presented a series of maladies, diseases, symptoms, how can I quickly and efficiently identify what that is? And I know that a nurse doesn't necessarily diagnose a patient, but you do, right? Even though you can't say to the patient, this is what you have, you know, I would like to think that we are providing the clues for the doctors, for the medical providers of what they're looking at. And, you know, in the case where we might know more than them, being able to say, hey, this is what I think it is. And I already know a lot of nurses that I follow have been like, documentation is super important, so learning to type properly is also going to be a thing I do. I've never actually learned how to properly type, and it bothers me very much. Like, I can type quickly, but it's not necessarily about hand placement. Like, I'm not necessarily that person that's like looking at, but I also can be. If I get too much into my head about it, I will like look at every single thing I'm typing, and that's not necessarily bad. But I do want to kind of master my typing as well. Now, I've been rambling for long enough. I've been talking your ear off for long enough. If you guys have any tips that you have for studying while out of school, or creating a personal curriculum, or maybe videos or resources you think that I should look at, let me know, and I will see you in the next video. Thank you.